What do iPods, lawnmowers, and hairdryers all have in common? They generate enough noise to damage your hearing. A recent study published in the Archives of Internal Medicine estimates that nearly 1 in 5 Americans over the age of 12 have significant hearing loss. Paige Holt, Doctor of Audiology at Lake ENT, says ringing in the ears is often the first sign of hearing loss.
Ringing in the ears, what we call tinnitus, is something that is a symptom of damage to the hearing nerve. Symptoms of damage to the hearing nerve are tinnitus and hearing loss, and the two of them usually go together. So many people will come in and say, my ears are ringing, and one of the first things we will do is test the hearing, because we want to determine, is there some damage or degeneration of the hearing nerve that can be associated with that ringing. There are many different things that can cause hearing loss. The most common would be aging and just degeneration of the hearing nerve. Noise exposure, women and men who work in a factory around loud equipment. Hearing loss can be genetically related, and so we always would recommend that if you do have a strong history of hearing loss in your family members, that you do start having your hearing screened in your middle years, because we want to know what your hearing is, a baseline, so that if you do have something happen and you start feeling like you're not hearing very well, my ear feels plugged up, I have some fullness in my ear, I have some ringing in my ear, then we can have a hearing test performed and we will have a baseline to compare it to, so that we can determine, is your hearing starting to progress? Is this just an episode that we can treat medically and have it recover, or are we starting to see some aging? Anytime someone is working around loud equipment, working in a factory, maybe they have a lawn company, a lawn service, they do need to be wearing earmuffs or earplugs to protect themselves from the loud equipment. Occasionally we will see someone who has a sudden hearing loss, and there are some ways of treating sudden hearing losses that we might see some recovery. But in general, when you start to see the gradual progression from the aging process, it's not something that we can recover. As aging occurs, there's damage to the hearing nerve. There's no way to stop it from happening. You'll just continue to have a progressive hearing loss over time. The hearing aids will help you hear better. They will not cause further hearing loss, and they will not really prevent further hearing loss.
Paige recommends these 3 tips to protect your hearing. Lower the volume. Repeat exposure to more than 85 decibels can cause hearing loss. Plug your ears. Anyone regularly exposed to loud noise needs to wear earplugs. Skip cotton swabs. Instead of clearing wax out of their ears, many people end up pushing it deeper into the ear canal, which leads to blockage, a common cause of hearing loss. For more information on the audiology services offered at Lake ENT, please click the Early Hearing Loss Story Link icon on our homepage, yourhometownhealth.com.